Welcome to the Virginia Hospital and Healthcare Association's Patients Come First podcast series, which can be heard on VHHA.com, Apple Podcasts, Spotify, and wherever else you get your podcasts. We're also on the radio each Saturday at noon and Sunday at 10 a.m. on 100.5 FM, 92.7 FM, and 820 a.m. across Central Virginia, and Wednesdays at 1 p.m. on 93.9 FM in Richmond. Send any questions, comments, or feedback to pcfpodcast@vhha.com. That's pcfpodcast@vhha.com. I'm Will Selden with the VHHA team, and today we're pleased to be joined by UVA Health neurosurgeon Dr. Elisa Kucia for a conversation about her work, how personal experience as a youth helped shape her career path, and more. With that, welcome to the program, Dr. Kucia. Thanks so much for joining us.
Hi, great. Thanks so much for having me.
It's well known that formative experiences can be so impactful in shaping the trajectory of our lives. I think that's the case for most folks. And so getting to know people, for me, it's fascinating to hear those personal stories that influence people's paths and how they get to where they are now. And so from what I've read about you, the approach your parents modeled for you while you were growing up, as well as your own experiences through injury as a competitive runner in high school and things like that, ultimately helped steer you toward your career in medicine. Can you tell us a little bit about that and your experience?
Sure, yeah. I think when I think back through my life and kind of what got me to where I am today and helped lead me down the path to neurosurgery, I don't think there's, sometimes people will say, oh, I had this one role model in life or this one person or thing that got me there. And for me, I think it was just a lot of little things that added up over time to take me to the place that I ended up. And, my parents, as you mentioned, I think were always really, really good role models for me, really encouraging me to work really, really hard and try my hardest, my best at everything I did. And I think in my life, if there were two options, whether it be in sport or in school, where there was kind of an easier option or a harder option, and I would go home and talk to my parents about it, my dad would always say, oh, well, why don't you try the harder option? You can do it. I believe in you and that kind of thing. And so I think it really encouraged me throughout life to believe in myself and think that I could take on a hard task and accomplish it. And, they were always there for me to support me through those things, through challenges and whatnot. As you mentioned, I was a competitive runner in high school and college, and I did have many setbacks along the way where I had, stress fractures and other injuries. And so it was really kind of learning to battle through those injuries. And that's where I had my first little introduction, I think, even into the medical world, because you would have an injury and have to go to the athletic trainer or even see a, orthopedic surgeon or something like that. I had bone scans and x-rays and ultrasounds done throughout the years to try and, sort out different injuries that I had. And I always thought it was really neat and cool to even look at x-rays or ultrasounds to see inside the body and see how these people could, help me through various injuries and figure out what was wrong with me or what was causing me to have pain. And so I think that both of those things really helped to guide me, both, this encouragement for my parents to work hard and strive to do difficult tasks, and then also kind of seeing how healthcare providers could really, use their skills to help me accomplish good things in sport as well. And so I think, all of those things kind of drove me to want to try to take on something hard and challenging throughout life.
I apologize in advance for using this phrase, as I'm sure you hear it a lot as a neurosurgeon, but the whole cliche of it's not brain surgery. So as a neurosurgeon, a lot of folks, see that as sort of rarefied air, as professional sophistication and that sort of thing. So can you describe just your general experience as a neurosurgeon, what kind of patients you see, the kind of conditions they have, and then the types of procedures that you perform as a neurosurgeon?
Right. So neurosurgery, I think, has kind of multiple different aspects to it. And obviously, when I was in training to become a neurosurgeon, I got to see all the different parts and pieces. But primarily, we think of, there's brain and there's spine. I think it's to kind of simplify it. And when we talk about treating patients that have issues with their brain, it might be a brain tumor, or some people have trauma, where they're in a car accident and have bleeding into their brain or that sort of thing that we deal with. There are some more subspecialized things in neurosurgery where people with movement disorders can have implants placed to help them. And then there are people that have troubles with blood vessels in their brains, whether it be an aneurysm or something like that, that we can treat as well. The other side is spine, which, I'm sure as you're aware, spine problems, people with neck pain and low back pain is one of the leading cause of, pain throughout the United States. And so we try to help people that have problems with their spine, whether it be, you've developed what we call degenerative disc disease or arthritis of the spine that leads to stenosis, which is kind of narrowing of some of the tunnels for the nerves. And we can do different surgeries to try to relieve pressure off nerves from that narrowing of the tunnels or disc herniations or whatnot. And so throughout the years, I've kind of done different things. A little bit of my career has been influenced by trying to also support my husband through his career path as well. And so for the most part, I've always been what we call kind of a general neurosurgeon, where I've been in a community practice where I was treating patients both with brain and spine problems, maybe not doing the more rare cases that are done kind of at our bigger referral centers throughout the country, but some brain tumors and trauma, and then, a lot of spine. Here in my latest job here in Culpeper, I'm really at a smaller outreach hospital where I still do some cranial work, but for the most part, I'm treating patients with spine problems.
Gotcha. Well, thanks so much for that insight. We're recording this episode of the podcast in March, which is Women's History Month. And so while strides have definitely been made in terms of gender and ethnic diversity in STEM fields, including medicine, more progress can obviously be made. So when you were attending medical school, at the time, UVA had never trained a female neurosurgery resident, and there were no female neurosurgeons on staff. So obviously times have changed, like we mentioned, but I wonder how the conditions that you experienced during your training shaped how you passed those lessons on to other folks, and just your general view on your role as a clinician.
It kind of all goes back to, my parents and them really encouraging me to kind of do hard things and really take on whatever I wanted. And so even though I didn't have a lot of great female neurosurgery role models, I never really let that bother me or stop me from trying. And while there were no female role models, I actually had a lot of encouragement from men in the field at the time who I worked with to stay active and involved in something that I was interested in. And so, there were some people who would say to me, oh, well, women don't do neurosurgery or something like that. I never really took that to heart or let that stop me. And so I don't feel that I was ever, horribly discriminated against in any way. I feel like I actually had a lot of support from the people around me at the time. And, maybe that was me just being lucky with the people that I came into contact with. I think sometimes in life, that's how it happens. You make the best of the circumstances that you're in, but also you're given, sometimes people in your life that are just the right people you need to encourage you to continue to do something. And then, when I was in medical school, I had mentors who helped me do research projects and other things to really help along my interest in the field. And then when I got to residency again, I had a wonderful chairman and program director who really helped encourage me to do my best. And even the residents that I was around, the people that we train with, I never really felt like people said, oh, you shouldn't be here or you shouldn't be doing that. And I think that it's one way that I'm very, very fortunate to have just been surrounded by great people that encouraged me along the way, even though there were a lot of hard times and suffering through residency. But again, just very fortunate that I had good people around me to support me.
Well, that's great to hear. I want to drill down a little bit more. There was an article in 2019, I'm not sure if you've come across this or not, from the National Library of Medicine that was basically about comparing a couple different metrics across neurosurgery for males and females. And so there were a couple metrics that were fairly similar. they were working full-time, days worked weekly, and then gross salary. And this article claims that those didn't differ too much between male and female neurosurgeons. However, there was some discrepancy when it came to more personal metrics, such as career fulfillment, likelihood of choosing a career as a neurosurgeon again, likelihood of being married or having children, that sort of thing. So I want to ask you this question, and it might be a tricky one. It's a pretty big one. Do you have any comment about that, on what it says about the medical field, the education system that brings folks up in the medical field, and then society at large?
I think that women in general, we do have a little bit of a tough role, because I think that we are really struggling to try to keep all the pieces together, right? I think that, there are so many, almost balls that we're juggling in the air. Like you said, we have our career. Some of us want to get married and have families, and then you've got children, and then you're running around trying to take your kids different places and do different activities. And so from my perspective, I think one of the things that's really helped me in life is, as far as, defining success, I don't define my success the same way that I look at what other people might think as being successful. I don't need to have the highest salary or make the most money. And I know that there may be plenty of other neurosurgeons that are making a lot more money than I am, or are, spending more time in the hospital than I am. But I think that for me, the success is really being able to, it sounds kind of cliche, but, do it all. And as women, I think sometimes we take on all these things, and we may be doing a lot of things, but we may not always feel like we're doing all of them well. And I think that's the hardest struggle, is trying to figure out a way to juggle all the pieces and parts and have fulfillment in all different parts of your life. And like I said, I think it's really understanding for yourself what is success, because there are other women in neurosurgery who may not have the same goals that I have. And maybe their goal is to be a chairman of a neurosurgery department one day. And maybe they don't have any children, but that might not be a goal of theirs. And so I think it's really understanding for yourself what your goals in life are, and what success means to you, and where you want to end up. And so for me, I really want to make those connections with my patients, and I want to go home with the satisfaction that I've gone to work and I've done the best that I can, and I've treated patients the best that I can, and provided them with the best care. And then I also want to go home and spend time with my 10-year-old and my 8-year-old and my 3-year-old. And I want to be there for them when they ride their bike for the first time, and that sort of thing. And so, like you said, I think everybody's trying to define these different things and look at these different metrics, but I don't necessarily know that we can generalize these numbers to everybody. And I think that we have to understand and really support everybody to reach the goals that they want and that they're striving for. That's what I would want for everybody, is to have everybody reach their greatest successes and their greatest goals in life, whatever they might be.
Yeah, those are great observations. I think the personal definition of success is probably the crux of it there. So thank you so much for hitting on that. Before we let you go, Dr. Kucia, we've got a fun ritual here on the podcast where we like to close each episode by asking a few more lighthearted questions so that our listeners can get some insight into our guests beyond the work that they do. So we recently mixed things up. Instead of asking you our 2 standard questions, we're going to give you a choice. So we've got a bank of 10 questions here. I'm going to ask you to choose 2 numbers from 1 to 10, and then I'll ask you those corresponding questions. So whenever you're ready, I'll have your numbers.
2 and 10.
2 and 10. Got it. First question. What is your ideal vacation destination and why?
It's difficult. I think my ideal destination is a warm, sunny beach. I think it's a great place to listen to the waves crash, soak in the sunshine, go for a swim, just sit back, read a book, enjoy, get away from it all.
Love it. That sounds good to me. Alrighty. And the final question. If you could spend the day with one person from history, living or otherwise, who would it be and why?
I'd honestly just love to spend time again with my my grandma, my dad's mom. she just has a great immigrant story of coming to America from Slovakia with nothing and making it happen. And I don't necessarily know that I always appreciated her journey or her story as a kid growing up. And I'd love to just sit down with her again and talk to her about everything that she went through and how she did it all. She was kind of an inspiration to me throughout my life as well. So I'd love to have a chance to kind of, as an adult, go back and just chat with her again.
Well, those are two great answers. Thanks so much for sharing that. That's going to bring us to the close of another episode of the Virginia Hospital and Healthcare Association's Patients Come First podcast series. If you like what you heard, please make sure to leave us a 5-star review on Apple Podcasts and subscribe so you know when new episodes are released. We want to once again thank our guest, UVA Health neurosurgeon, Dr. Elisa Kucia, for joining us today. So, Dr. Kucia, thank you so much. It's been a pleasure speaking with you.
Thanks again for having me.